Hello, everyone. It's April 16th today. We're almost done with the week. Welcome back. My name's Kelly Baltzell. I'm the CEO of Beyond Indigo Pets, and you're joining us on our Facebook Live. I am super excited today because we have a view from a hospital, and we have Dr. Judy Hung here, and she has agreed to come tell us from her point of view about her experiences with the COVID crisis and what she's seeing with patients, what she's done within her own hospitals, maybe some tips and tricks and positivity out there. So I'm super excited. So I'm going to let Judy introduce herself more because that's what we do here at Beyond Indigo. We let people introduce themselves. And Judy's going to run you through a few things. You'll still hear my voice, but you won't see my face because we need room to show some really fun pictures Judy brought today. And at the end, we'll bring me back on so you can visually see me. And then Judy and I will talk a little bit, and that will be our day. So Judy, do you want to tell us a little bit about you and like geographically where you are and all of that?
Sure. So my name is Dr. Judy Hung. I'm a small animal veterinarian with my practice in Kirkland, Washington, which you may have heard of, which it was the epicenter here in the U.S. And so we just were probably a few weeks ahead of most of you guys in terms of our exposures. So I have two hospitals, actually, about 7 miles from each other. And so my first hospital, the one that I mostly work at, is in Kirkland, Washington, and the other one is in an area called Renton, Newcastle, and that is my big hospital with boarding as well. So that's been very different now, as this is actually technically spring break week, and we were fully booked, and so that has completely changed as well. So we had to come up with our plan a lot earlier and really without very much guidance. And so here we are, and we keep on evolving with different things that we learn. And so I just wanted to share with you some of the things that we started with and maybe some things that we'll probably have to change, especially as we continue to make this a longer term change to protect our people. That's really to protect our staff is really one of the first goals. Obviously, it's the main goal that we have to look at all our protocols with.
Totally. And like I said, and you and I were talking, you guys are kind of on the front lines. You saw this before other people did. So you were writing the textbook before anybody was even reading the textbook. Like you're the ones other people learn from.
Yep.
Yeah.
So we had plenty of mistakes. Well, mistakes or things that we did not expect. What does curbside mean? I think a lot of people think that's a drive-through and that we're going to do everything and get the pets out of the car for them. And we had to quickly change that. We initially allowed the doors to be unlocked, and people don't read signs. So despite numerous signs coming to the building, including the huge one at the door, still come in. So right off the bat on day one, we already had to lock the door.
Now, don't you have some video of curbside that we were going to show about what your curbside protocol is? Yes. I know there's a really cute dog in this. That's right away. I was like, oh, that dog is so adorable.
Yes, that is Juniper. She is adorable and happy everywhere. But we have a double leash system, of course, because my big fear is these pets getting loose. As you can see, I am 2 blocks from the Kirkland Costco, lots of traffic going through. So we do not want to have a chance of these pets slipping out of the owner's leash, collar and leash, and running into the street. That is a huge fear of mine. So that is
that's a legit fear.
Yeah, decreased a little bit with the double leash. However, since this video, we have also now pushed a little bit more, or actually a lot more, to the doorstep system, which basically we're asking them to meet us at the door that is locked. And they are good at socially distancing themselves. And it's not like we have a queue of people outside. So we just tell them when and what door. We labeled all our doors now, door 1, 2, and 3. Okay. And then they just meet us at the door. So we have even less chance of the pets slipping out of anything, and also decreasing our workload on our people, because as you can see, we don't have a huge parking lot. Our people are having to go, our employees are having to go down the street looking for people, and that's just, was logistically not working out. So we decided to make that more of the standard, compared to if somebody truly had a mobility issue, of course, we would come out to them.
Now, do you tell people what door to go to when they first call in? Is that what you do with your protocols?
Yep. So now, we evolve probably every week. We've discovered, again, my staff was getting really tired, and it's taking a lot of time to go down the streets and doing this. So this has reduced some of that workload for them. And so now it's just every day we communicate, and we work with each other, the front staff, the back staff, saying, hey, I'm getting tired of going outside. Can you tell the clients when they call in, which door to meet us at? And so that's been working out. And so it's still a work in progress. It's all of us trying to communicate and learning those things on the fly.
Right. It is a learning curve, right? And all we can do is learn from the learning curve.
Yeah. So this video was about 3 weeks ago.
Okay. But it's where some people are today.
Yeah.
Some hospitals today are.
And some people have great, parking lots right at their, doorstep. That's great. But for us, we don't. And we're in a kind of a dense suburban area. Again, right 2 blocks from Costco. And so we have no street parking, hardly, and very little parking. So this is how we have to do it.
No, it makes complete sense. I mean, my vet's the same way. They have like a parking lot the size of a postage stamp, backed up on a busy road. And so that's good. No, that's cool that you've numbered the doors, because we've heard other things that some people think the drive up means McDonald's style type of care, right? Like however that's going to materialize.
Yeah.
And then you bring the dogs back out when you're done, right? And
correct. Or we meet them at the doors, just at the doorstep, and that way. So either or. Like now we just have those 2 options, whereas in the very beginning we kind of imagined this being the only option.
Okay. But you learned and you changed.
We learned. You could see how many steps this takes. And this is actually one of the shorter parking spots here. I mean, like closer ones.
And the dog's pulling on you. That gets
Yep. Right? And it's really hard to pull a pet away from the owner to bring them to the hospital.
Oh, that's true.
And you have even more chances of them slipping the collar because they're trying to get away from you.
Right. You were not a big fan of their life right there.
Yes.
So that's pretty cool. That's one of the adaptations. And then your 2 hospitals, you've split into 2 teams now, right?
Correct. We used to share. One of my doctors would actually be coming up to do a shift or 2. And we actually had to stop that, because just in the event that she comes down positive, it is possible she could infect both teams. That does lead to everybody making a sacrifice, sometimes, doing different roles. I ended up having to pick up extra shifts because I am the doctor up here in Kirkland. And so I ended up taking another couple shifts because of that. But, it is what we have to do. And that's what we have to do for our team.
Right. Exactly. And speaking of your team, you have some pretty cute photos that they did for Easter.
Yeah. So even though nobody can see that anymore, because nobody comes into our lobby, my team just, still had their sense of humor and put the Easter decorations up with a mask and a fecal container. That's just, they did that. And that's just, it's such a great team. This could not have happened to a better team. We have the most rock solid team that is all committed to each other. And that's really that's a testament to them, for them making it through this, and not one person has been laid off. We have kept everyone employed.
That is awesome. Kudos to you. And like you said, you're having to work harder during this time.
Yes.
Right? Like, I mean, you're rolling up your sleeves and putting in extra shifts, and you're probably all exhausted.
Well, it's worth it for our team. And it actually, I'm the rate limiting step at my work. I am the one that chats with the clients. I'm the one that makes them run behind. So now, without so much chatting, we actually finish on time. It's actually surprising, but I do miss the chatting part. That's kind of obviously the building of the clientele part, but they still are very appreciative, and even the new clients feel bonded to our team already, even though I've never met them in person.
Right. Well, that's wonderful. You have some other photos here that I thought were really cute. Let's roll through them for a minute. You can explain
Sure.
what you're doing.
So this one is, so as we've learned more about masks and how important they are, and I will say in the very beginning, we, of course, masked up to go to outside, but we didn't necessarily do that inside. But shortly afterwards, we decided that it is important that we have to make the assumption that everyone has a potential. Even our own coworkers that we know are very careful. So we did end up just requiring everybody to wear a mask inside, especially if you're going to be working within 6 feet of each other. So in order to practice good stewardship of our mask, we assumed what we're reading, which is viruses can't live on these surfaces for over 72 hours. So we basically assigned the number of masks to however many days shift that they are working. So they never use that same mask again for over a week. And so we hang them up in the sunlight so that UV light can hopefully kill off some more of the virus. And they're not supposed to touch each other, of course. None of the masks touch each other. And so that's what we've done with our space now, because nobody's coming in the lobby. It doesn't matter that we have these things in the window.
This is awesome. And are those by days? Are those grids by day?
Nobody, we usually schedule a 4 10-hour shift. So we don't have anybody that works 5 days. So we just did the 4 days, and their names are along the side. And then they're actually just little paper clips that hold the the tape up. So we didn't have anything new that we had to buy. Initially, I was a little stressed that I didn't have these suction cups and perfect little, things that held them. And my team just did that without anything else that I couldn't go to the stores to buy stuff. So that's kind of why the tip of the day is that way, is just use what you have and have people who are creative come up with things. Because I was stressing over not having suction cups.
Right. That was your bottleneck. Right. That's awesome.
Yeah. And then, and this is just, we don't usually use big, huge bottles of alcohol. We usually pour them into smaller bottles that we use to, draw blood with. But instead, I just took one of those nozzles and just stuck it in there. So now we could just spray down any surfaces quickly and use that for our hand sanitizers, since there's no more gel kind and the smelly good kinds. So we just go straight 99%.
Okay. Well, that does the job, right?
Yeah. So again, I wasn't going to fret anymore about not finding sanitizer. We were a little ahead. So even despite having maybe a couple weeks in advance of most others, I still couldn't order any sanitizers. So just FYI, if you can't get any, it's not just you. I couldn't even order it like more than a month ago.
Yeah, I think it's all in some guy's garage in Texas.
Yes. So this is a picture of a converted exam room. So now that we are not using our exam rooms for clients, we can actually just separate out our teams even further. Just they set up their own stations with all the things that they need, so that they're not going back and forth to the treatment areas to get the equipment for their treatments in the rooms. So of course, this is not doing surgery, but this is most of our cases, which are outpatient. So they just organized in a way that they can minimize the traffic going back and forth getting supplies.
That's pretty cool.
More directions. So we split our big hospital into several teams. So if you're on, team A, B, or C, you can have your own zones, but we have different traffic patterns so that they're not crossing each other's paths. So we used a lot of our blue masking tape on the floors and arrows. And we are using our double Dutch doors there, as you can see, so that if the receptionist needed to get medications for a client to pick up, that they pretty much just stop right at that door. They're not crossing anything. And I think we have one of the pictures for the medication pickup, which we, instead of putting them in where we had to cross the receptionist area, or where the receptionist actually had to cross our area, we just used our retail displays so that it was easier to reach, and we put them in clear baggies so we can actually see the medication. So it was easier for everybody to access without crossing the lines.
It's a really cool idea.
And then just thinking about everything we use. So our clipboards that we write on, our pens, we sterilize them every time. So, or, you know,
Right.
not through an autoclave, but, you know, clean the surface of everything every time we use it.
That's awesome.
And the leashes, of course, get washed in bleach. So we always take out one of our own leashes and we wash every single one.
Okay. Just extra precautions, keeping it all.
Well, we wouldn't want to have that be the vector.
Right.
Yeah.
One thing. Yeah, that is totally awesome. These are great photos, and I love the mask. The mask is just
Yes, so everybody's being creative, but we do, again, for our employees, they have everything they need to be safe. And I think some of the rules we used to power through when we were sick as medical professionals. We used to, that's probably the biggest learning or the biggest change is that we just say, nope, you can't. If there's even a slight illness that you might have, you can't power through it. You just have to stay home. And actually, I would say with all the cleaning that we're doing, I actually have less people calling out sick.
I bet you do. I mean,
so,
right?
Yeah. So, I mean, it should be that way because, I mean, I thought in the very beginning, gosh, I wonder if this will make people less sick. And it actually did. So I was surprised by that. Of course, that can change anytime and how serious we have to treat that sickness. I mean, even though it's mild, we have to treat that very, very black and white, very definitive compared to before. You know, it's like, oh, you know, why don't you see how you feel and, you know, go home if you don't feel well. And that is not an option at this point. You just don't come in. You cannot affect the rest of our team that is working so hard to care for patients.
Right, because it'll shut your hospital down for a couple of weeks.
Yeah, and we'll have to talk to, for that individual situation, we'll have to figure it out at that time. But that's just that's the things that we have to make a sacrifice to make those decisions to stay home if that is what happened.
Right, which, in a way, then that individual gets healthier quicker if it's not COVID and doesn't make everybody else sick, right? I mean,
it's how you care about your team. And I think a big thing that really helped us in the very beginning, because I had several staff meetings and I had to kind of change every single time because the different rules coming from the state, what type of, guarantee that we can have for their paycheck. Before that even rolled out, it was just my commitment to them that we were going to keep everyone open and employed as much as we could. I didn't know how that was going to happen, but that was at least one of the things that we tried to do in the very beginning. It's going to be individual for your locality because there are different rules that your governor may have, what are considered essential workers versus not. But I think for the majority of the U.S., veterinary medicine has been considered an essential business.
Yeah, it has been. And for many reasons, public health, personal health, mental health. So it's good. So with all these changes you make, do you have any idea which ones you might keep after the COVID?
Yes, we're actually, for our boarding, which is non-existent right now, and we've repurposed our people to come and help clean more often, which has been really helpful. They help grab the phones because the phones are, of course, much more tied up with multiple phone calls for every client. But one of the things we're super excited about is just not taking any bedding, any personal belongings. That was always a hassle to begin with. And now, we just don't want to have that risk. Even after supposedly this might be over or the curve has been flattened, there's still going to be a lot more risk if we're taking in a lot of personal belongings. So we just want food and medicine, and that'll keep things simple. And so we're excited about that. The other thing that I'm excited about is creative use of our space. Before, we really didn't think about our spaces being used that way. My Kirkland office we work out of 1,300 square feet. We only have 2 exam rooms. We really felt like we couldn't do much more than what we were doing just out of the 2 exam rooms. And now if you could think about it as, well, not that the patient has to stay in our hospital. Now, if the client's willing to wait in their car for their pet, I don't really need another exam room. We could just continue it that way. And if they're willing to hang out in their car and then have me do the exam inside and then return them to the car and they're hanging out in the car, that's like an exam room. So I don't have to have another exam room built. So I'm excited about that because I really did not want to do another construction project after building the second one. That was probably took a few years off of my life. So I'm not going to do that again for a while.
Right. But it is using your space better, differently. And it also saves, like you said, expense, wear and tear on you.
Yeah. So if for clients who are willing to do it, it's an option because I don't have enough space to keep their dog for the day.
Right.
So we could certainly admit the patient. We have a few, spaces for that, but, they get stressed, they bark, so this might be a different way to see more patients without having to have clients in the building.
That would be pretty cool. We'll have to check back with you later.
Yeah.
Well, thank you so much. We really appreciate your words of wisdom and the photos. Those are just great. Thank your team for their creativity for us.
I will. And for the new people who are doing this, you can do it with the things you have.
That's good to know. Like the paper clip and the masking tape and the masks and brilliant right there.
Yeah. You just got to be MacGyver for a while.
That's awesome to see what rummage in the drawers.
Yep.
But I think you're right. I think we get all fancy sometimes. And we just have to have it just perfect and just so. And instead it's like, let's go. Right?
Yeah.
Let's figure out what we can go to now.
Yeah. Exactly.
No, that's awesome. That photo is great. Thank you for sharing that.
Yeah. Thank you for having me.
You're welcome.
Stay safe and be well.
You too. Bye.
Bye.